Okay, so we'll be live, it'll say on the screen. Good afternoon, everyone. Welcome to our webinar this afternoon. Today's topic is supporting injured workers returning to work. We thank you all for joining. This is part of the Recovery Partners webinar series. My name is Kelly Ryan Brown and I'm the founder and director of Recovery Partners. These webinars will be run throughout 2025 as part of our ongoing commitment to providing continued education to our customers. I'm very pleased to introduce to you today Andrew Brand, who prefers Andy, so you can be casual with Andy with your questions. He's our branch manager over in Perth, Western Australia. He's a physiotherapist that has got extensive experience in musculoskeletal injury treatment, chronic pain and biopsychosocial management. So please welcome Andy. Andy does welcome your questions, and how we take questions in this webinar is through the chat function. So drop your questions in there and Andy will attend to them as we're going through the presentation and then again at the end. Over to you.
Thanks, Kel. All right. So as Kelly said, yes, my background is I'm a physiotherapist, which for me has led me down the pathway of a lot of chronic pain management, which I find quite beneficial when you're trying to help with injured workers returning to work. There's a lot that comes with education and understanding around pathologies that can be quite translatable. So that's me. So yeah, the topic today is going through supporting injured workers returning to work. And we'll be looking at some evidence around the return to work process, as well as then moving on to have a look at a scenario and to essentially break it down through the lens of an allied health professional, what I might see within a scenario to identify some areas of concern, some barriers, get the full picture of how a person is presenting, utilizing that biopsychosocial model. From there, starting to look at how we can effectively communicate and engage with workers, identifying early barriers and provide some education and resources for the workers, all in the idea to improve outcomes when it comes to helping someone get back to work and forming a supportive environment for them. So just on some facts and statistics about return to work, something that I see often is that people, when they are as part of a compensable claim and they are injured, often it can be the case that these workers have never had a serious injury before and they've never had anything that has really affected them to the point of not being able to work for potentially a significant amount of time. It's really important from my side to make them aware that there is fundamentally no difference in their pathology, whether they're injured at work or outside of work. But there is a bit of a stigma that comes with the label of workers' compensation. There's no getting around it. People have preconceived notions, be it your colleagues, your friends, your family, even some supervisors and people who aren't quite understanding of that situation. Maybe they've just not been exposed to it. The reality is not that. It is a system of support. So how do we help improve that support? So workers who have been given the opportunity to actively participate in their return to work and their planning significantly improves their outcomes of their return to work. It fosters a collaborative approach and gives them ownership over the process. So in New South Wales, CIRA, so the State Insurance Regulatory Agency, found that early engagement with workers and discussions around their return to work in a tailored approach resulted in significantly increased return to work rates. So from physical capacity, 88% would return with that early engagement versus 70% without. And when you start looking at psychological claims, it's a 77% returns with that early intervention versus 53 who have no contact. So that's quite a difference. If you start looking then at the 2018 National Return to Work Survey, there were 35% of physically injured workers who were not contacted by employers versus 61% of psychological claims that weren't contacted. It's quite a difference when you start looking at physical versus psychological. Psychological is harder to approach, and it is a less comfortable thing for people to approach. But it is important to do so. So the difference in perception of a positive experience came in the form of perception of employer support, provision of information around their rights and responsibilities, provision of suitable duties, and being felt like you're treated fairly during and after the claims process. So if you start looking at those key points of what workers perceived as a positive experience, it starts to break down that stigma of the workers' compensation, and it starts to help foster and build a collaborative relationship with the worker. So, slides again. There we go. And yes, most people will return within a 7 to 12 week period, and majority of workers do return after 12 months. So this is a scenario now. So Jeff is a 42-year-old male who was injured at work, injured his lower back 4 months ago. Was diagnosed as a facet joint strain, and his physio and GP diagnosed him. His friends have noticed a change in his behaviour and that he is more absent and frequently doesn't return their calls. Excuse me. His employer has also noticed that he's not responding and has concerns over his engagement and commitment to his return to work, as his injury is now past the point of what was expected. So if we just dissect this a little bit, there's a lot that you can gain from this broad snapshot of a generalized picture. So Jeff is 42. He's not that old, but he is in middle age, and he likely has family commitments based on his assumed stage of life. He is also probably starting to notice a little bit of a decline in his physical activity and capacity based on his age. He's not a spring chicken, but if he stays relatively fit and active, he could still be feeling quite physically capable. However, at his age, he is looking at increased risk factors for musculoskeletal injuries. And at 4 months down the track, following a facet joint sprain, it is longer than expected. So it is, by definition, a chronic injury now. Now, that comes with a list of changes that happen on a physiological level, not just the structural pathology. And it can increase his perception and experience of a painful scenario. So also with a 4 month time frame, you expect there's going to be a level of deconditioning. He's not able to do what he usually did in and outside the workplace. So if he was someone who was relatively active and played sport, but now he can't, there's a lot of activity that's been removed from him. He's also become a bit socially withdrawn, which can indicate a little bit of a change and decline in his mental health and well-being, particularly as a male. Often with male friends, anecdotally, we're not so good at noticing these things in our friends. So the change might be a little bit more profound. So the concerns Jeff's employer has are very understandable, but it can also then change the color of their contact with Jeff. It might flavor their conversations a little bit more. It could be a negative association. Jeff is also increasingly removed from the workplace, so his connection to his colleagues and to his environment that he's so used to has been changed. Along with the loss of his capacity in and outside the workplace, he does have an extended time frame. So you start putting those things together, and it can result in psychological impact and a perception of the "what's wrong with me" question. Why aren't I improving? Why can't I do this? I used to be able to do that. Which does have an impact on his psychological health and how he perceives and treats his injury. So, breaking down the background, obviously we've just seen that not everything is potentially as it seems. Now, Jeff's got 3 young kids, so he's unable to adhere to his physio guidelines at certain times because it's not realistic. His child might fall over, he might have to act and use his dad reflexes. So not being able to continue to adhere to strict guidelines, there may be some things in his life that are just progressing the injury, or just continuing it, nagging away to make it not recover as expected. Given that the timeframes have been extended from what is generally expected and anticipated for this sort of injury, then it comes with some other changes as well. So not everyone does follow the expected pathway, and it's important to understand that. So if Jeff doesn't know that, then it could have more of that "what's wrong with me" psychological questioning. And it does impact the changes from a physiological level as to how he experiences that pain. So as we can see, his wife has also then started to take more time off work for herself and assist with things around the house because Jeff is no longer able to help as he once was. Financial concerns are huge. Everyone can understand. It creates a lot of stress around your life, added to the point of having reduced capacity and being stressed about his injury. From a hormonal level, he'll have increased levels of cortisol, which have implications in how you perceive pain, become more irritable, depressed mood, and you stop being so active. So it can also then impact your interpersonal relationships. So overall, his psychological well-being is being affected. Feeling like a burden is also another contributing factor there that can happen, not to make too many assumptions about Jeff and his home life, but it is something that I often see. So his negative mental health impacts are also going to be increased by his level of social engagement. He doesn't really have a break. He's just living at home his life of his injury, trying to keep things afloat. He's also very scared of being re-injured again. So that's where he stops moving so much. He's scared of something else happening at home and his injury continuing on. That is a little counterproductive to how things are treated from a musculoskeletal level. He wants to get his life back, but he's scared he's not able to do so, and that his pain and problems will get worse if he does. So, as you can see, his presentation is no longer black or white. He has a sore back. He's not sure why it's still going on. If you ask the question, why isn't he at work? Now we've got a bigger picture. So the truth is a bit more nuanced than what it first seems. So now to have a look at some strategies as to how we can improve the support and the management of someone like Jeff's condition. So a communications plan is something that can be set up at the very start of an injury or of a claim. So this way you can increase the worker's feeling of being supported in the workplace. You can maintain the engagement as part of a team. So it doesn't have to just be collaborate with the injury management consultant, collaborate with the case manager. It could also be, hey, Jeff, we've got a lunch on. I know you don't have capacity to work. Do you want to come in for that? Then he gets to still be a part of the team. He's engaged with the workplace. He's motivated to get back to that environment. Lining up regular updates as a standard, or face-to-face meetings even, fortnightly, monthly, whether he's at work or outside of work. It locks something in the diary that helps know that there's a structured process here, Jeff, we can help. And if things change in that period of time, we know about it a lot more soon, rather than haven't heard from Jeff for a while. He must not be so genuine. Increasing that support does help to motivate the worker for return to work efforts, but it also helps everyone work as a team. It is very important, though, to remember that contact might not be as easy as you would like it to be or expect, particularly when it's a psychological injury. There may be some triggers associated with the workplace, or even your method of communication or frequency excuse me, might be something that is working against you. Even though you're looking for answers, communicating might actually be causing them to withdraw more. So it's simple as asking the question. You might not be able to get it directly from the worker. You might need to communicate through alternate trusted sources like their rehab providers, their GPs, allied health, welfare officers. But in setting up the plan, you know what you're facing and you know the avenue that is going to be best and most appropriate for the individual. Like Jeff, he might be fine with any contact, or he might be really tied up for time, trying to deal with things at home and prefer emails. So communicating with treatment providers is also a good option. Now, it's going to depend a little bit on your workplace and your injury management team as to their level of training, as well as an entity's regulations and rules around consent, whether they have consent to go direct to treatment providers. If not, then rehab providers and other sources can be, and even insurers and case managers can be another avenue to help collate that information and then discuss things. So rehab providers also, being allied health, they can communicate on a peer-to-peer level, interpret things from a critical lens, and then progress and translate plans as they are appropriate. Being very specific in your description of things like a worker's duties and the environment they work in can be very helpful. Not all GPs have a lot of time. I think we can all appreciate that they're very time poor, and they might not understand the industry or the role of which the worker works in that they're certifying them for. So if Jeff works in a warehouse for a construction company, and that's the information that the GP gets, oh, I'm in logistics, I work in a warehouse for a construction company. And GP looks at that and says, well, no, you can't do construction, you don't have capacity. But if they understand that his job's actually working in an admin capacity, and all he needs to do is get to work, he's got a sit-stand desk, he has ample opportunity for breaks, then that capacity starts to look more in line with what he can actually do. So understanding those clear guides of what is going to be actually required, what this worker is facing, can help guide a certification, but it can also help guide with allied health, with looking at what's going to be something they can implement at a site level throughout their day to work in to benefit their rehabilitation as well as getting back to work. Collaborate. There's a lot of really good providers out there that will be very open to discussing and being involved in the return to work process. And you might not get that full picture of how a person presents from just talking to them, but their treatment providers will get a better sense of how they can actually handle things. Also, when you're looking at something like a psych injury, they'll help you to understand how to communicate with that person. What are some things that you can do to help to avoid triggers if they're associated with the workplace, or how supervisors might interact with them? There's a lot you can gain from asking the right people. So early identification of return to work barriers is quite important, and it's not something that remains as an early stage. This could be 4 months down the track and something else has happened in Jeff's life that is going to drastically impact his return to work. But understanding that from regular catch-ups, from communication with him, means that you know about it earlier. So things that are commonly found in outcome measures used by treatment providers is that a lot of people have poor pain literacy. They have anxiety and depression that can be associated with their injury. So a physical injury is often not just physical, it impacts everywhere else. They have fear avoidant behavior, which is fear of movement really, and fear of pain or re-injury. Their sleep gets disturbed, which then is going to impact how they feel in the morning, their mood, their irritability, and people can focus quite a lot on pain. Educating the worker can really help to dispel some of these fears, but also give them some confidence and some understanding around what else they can do. But then you also know what you need to look out for. It is important though as well to remember you don't understand or necessarily know someone's level of health literacy, so you can't assume. They might present saying that they're very focused on their pain or they talk about their pain a lot. However, when you ask them, are you concerned about this? They might say, oh, I know it's there, but it'll be fine. So it's not actually a big barrier that needs to be attended to because they've got a level of self-efficacy. So further to that, we've got a need to compare their physical, psychological, and functional requirements from their role to their capacity. It's going back to what I was saying earlier about discussing a role with the GP to have an accurate certification. They might not have capacity for their pre-injury role at the moment, but maybe there is an area within the team or even another work area that they have some translatable skills that they can put to use. And that is something that you can also just find from the worker as well. Ask them what they think they can do. There might be an area that they've been noticing within the workplace that they feel that they could actually have an effect in. And rather than just pursuing some quite, to the worker, less meaningful tasks like placing them on admin duties if they work in a more active role, they might have something else that contributes that they could feel more engaged in. Scheduling those regular return to work meetings with the worker, the employer, can help to make sure that these barriers, as they come up, are attended to and understood, and then you can take action before they spiral out of control, before relationships get damaged, before physical injuries get worse, basically. So, how can you help? I like this picture from the Are You OK Day campaigns. It does highlight a lot of listening skills and digging a little bit deeper than the surface conversation of how are you? So if you ask Jeff, how are you? He might say, oh yeah, I'm okay. But then ask him, hey, but I know you've been injured for a while. How are things at home? Maybe then you're going to get a bit more of a picture as to some other impacts in his life that are going to contribute then secondhand to how he experiences his condition. Early interventions like EAP services, we do an injury reporting centre, which is a 24-hour immediate response to injuries. We can triage things, implementing rehab providers, or if you do have on-site treatment providers, some workplaces do, or a very skilled injury management team within the workplace, just trying to get in early, basically, and then provide them opportunities to be involved and empowered in their return to work process. Ask them what they can do. There will be a list of what people focus on as what they can't do, but what can you do? You can utilize some skills to still have some meaningful place within the workplace. Pay attention to non-verbal and verbal cues as well. So like we saw with Jeff, he has become a bit more withdrawn. His friends are noticing that he's not quite around as much. You might also see some other things. That's the social withdrawn negative impact on his relationships. You might find that when they are back at work on a graduated return, maybe they're a bit more short with their colleagues. Their interpersonal relationships and contacts are different to what they usually were. Jeff's pretty grumpy these days. He's not usually like that. You might notice that there's less activity overall. Maybe there's some weight gain or loss. Maybe there's some poor self-care or hygiene that highlights or indicates a change in their mental health and well-being. And approaching things as an empathetic person, consider yourself in that position. No one likes being injured. No one likes having a sense of loss associated with their worldview or with their life. People don't generally like being injured. Educating where you can, you don't need to be a health professional to educate someone or provide some cursory education on things like physical activity being good for your mental health. Physical activity within your capacity or limitations can help with musculoskeletal injuries. Talking about things is important. We don't need to be health professionals to translate this message. Obviously, when it comes to specifics, encourage them to talk to their treatment providers so that they are doing things well within their capacity if there is any doubt. So one of the things that we do all know about is that there are therapeutic benefits of being at work. You have a level of routine and structure, promotes stability in your daily routine, which helps to lead to better physical and mental health, regular sleep, eating, exercise patterns. Incidental activity is something that I love. I love to put it to people and give them an understanding, particularly when someone says, I don't have time to do my exercises. Well, if you think a little bit more flexibly, say Jeff was provided a squat exercise to do, but when I come home from work, I'm really sore and tired. Yeah, but you're actually taking breaks at work and standing up from your chair to walk around. Now you've got walking in there. That's a bit of exercise that you don't necessarily count as exercise, but every step counts. And when you're standing up from your chair, you can do that purposefully in a sit to stand motion that you would simulate a squat. So there's ways that you can incorporate general things throughout your day that steadily boost your level of activity and start working towards helping with a musculoskeletal or a psychological injury, because we know exercise helps with both. Once again, if there's any doubts about the type or how much incidental activity you're doing, speak with your actual treatment provider for an individualized context. The social support and interaction at work also can't be overlooked. It's interacting with your human co-workers, which helps with relieving stress and an overall increase in mental health, provided they are positive interactions. As much as a lot of people don't see work as more than just work, there are so many purposeful achievements you can get through work, even if it's just completing a task. As small as it seems, you still can get a little bit of a dopamine hit from that. And dopamine is pretty strong at regulating pain as well. So it's your reward drug, basically, within your system. And it can help buffer the emotional cognitive response to pain, overall reducing how you experience that. Improving how you experience it. Being at work also helps with behavioural changes, particularly say for Jeff, he can't sit for too long because his back's sore if he does. Previously, he might not leave his chair for 3 hours, but now he's forced to get up and move around. We know that that is just generally better overall for your physical health as well as your mental health. Take a break from the screen. Shift your focus. And empowerment. It helps give people a sense of empowerment that they can take control over what they're doing, particularly on a return to work plan. They're there, they can see steady progress. They might not feel initially that they can do this, but if you take little steps, get that foot in the door, then maybe that proves to them that, actually, I can do this. Maybe I can do more tomorrow. So something that gets very much attended to is pain. Pain is not what a lot of people think it is, but it is the most common symptom people will report. And it's something that's regularly asked about. Now, we know and have known for a long time that pain doesn't equal damage. I would probably argue that standing on a piece of Lego is the same as standing on a bear trap, but that's just me. But when someone's been in pain for an extended period of time, there are some physiological changes from a neurological level as well, where people become hypersensitive and their pain or interpretation of their pain persists. Essentially, the pain receptors become sensitized they begin to interpret generally innocuous stimulus as pain, because that's what they're used to doing and that's their function. And they've been doing it so often. And particularly in a chronic injury, this can spread to adjacent pain receptors as well. So the feeling of, rather than this small area of structural pathology, now they feel it in a bigger space. I also find language is quite important when talking to someone about their symptoms. Using the word pain focuses on that association with damage and that general idea of pain. So where possible, it can just be really helpful to avoid using the word pain, just because there's such a strong association with problem. Pain doesn't equal damage. That's not always the case, but pain is more equivalent to danger. Pay attention to something, but it may not be what you expect. So the reason I focus on pain is precisely because that is the most common symptom, and it's the most common thing that people will focus on. This is a video that I like to provide to a lot of people. And once again, like I was saying before, we don't have to be health professionals to educate people with these topics. They are largely common knowledge now, but sometimes common knowledge isn't as common as we would hope. So this is a video by Lorimer Moseley, who wrote the book Literally Explain Pain. And it's just an easily digestible way to explain to people that they might not be as bad, or the injury might not be as bad as they are feeling it to be. Doesn't discount the fact that they still feel pain. Cool. So I like that presentation, that video, just because it is very easy to digest and it's built on some pretty strong science. So it's an easy resource to provide to people. So what are some key tips? Basically, it's important for the worker to understand that we're here for a system of support. If you are able to create a supportive environment, then there is more chance or more likelihood that there's going to be a positive outcome with someone's return to work. Identifying your early risks and taking action to address them is also a very good way of preventing further issues. So prevention is obviously better than a cure, but if you start to identify some risk factors and stop them before they become a problem, then you're just winning all over. Approach someone as a person, not a pathology. So like Jeff, just a sprain in his lower back, but there's a lot more to his picture. Build an effective communication strategy with all parties. So that includes the treating parties, if you can, a rehab provider if they're on board, with the case manager, and importantly, with the worker. Listen and educate where possible. If there's something that's outside your scope of understanding or practice, then maybe discuss with the worker if it's something that they might need to chat with their doctor or their allied health provider about, and keep them involved in the process where possible. Remember, if they feel supported and they feel engaged in the process, then they are more inclined to continue with it. And statistically, there's more chance of a better result. So remember, most people want to return to work. However, it can be a scary process, particularly if they haven't had a major injury before and they don't understand what they're facing. Consider the wider impact of an injury and look for a collaborative approach to provide support. Many issues can be resolved with clear communication. Keeping a good rapport and building a good relationship can change things very easily. So cool. All right. So Bree's got a question. What happens if you have someone who has been off work for a while and relationships have broken down? That is all too common. However, I would say go back to basics. So start with trying to build that communication again, really trying to rebuild that rapport. You're obviously working on a back foot, but trying to reframe things, reset a bit, and encourage that we are still working from a place to get a good result for everyone, not just to get you back to work because we're paying you for something. It's to create that collaborative and supportive environment, because it doesn't benefit anyone for an injured worker to remain injured. So really trying to restart, I think, is probably the first step, and then taking it step by step to identify what the current issues are. Because if it is down the track and there has been a relationship breakdown, then there is likely a lack of communication. There's likely things that have been missed. So just restart, chat with everyone involved, including the treatment providers, to try and reframe the situation and rebuild that rapport. Basically going back to basics. Cool.
Thank you, Eddie. That was a great presentation. I like the Lego analogy. As a parent of 2 kids, I've definitely stepped on my fair share of Lego. And I think that the one thing that is imperative for everyone to understand is that pain doesn't necessarily equal damage. And it's that education process of helping people to understand that. So great session. There's lots of people in the chat thanking you for your presentation. If anyone does have any final questions, you can pop them in the chat. We will send you a recording of this session and the slides and some links to some further resources should you be interested in this topic. And as I said in the beginning of the webinar, please join us for our series, our education sessions that are available on our website to register for, that are running through 2025. So I think we'll just do a final check. I don't think there's any more questions. Thank you again, Andy. Great session, and we wish you all a lovely afternoon. Thank you.
No worries. Thanks, guys.